Hello, everybody. I'm San Francisco Mayor London Breed. I'm here at the 911 Center with a number of our public safety leaders in the city, including Director of the Department of Emergency Management, Mary Ellen Carroll, Dr. Grant Colfax of the Department of Public Health, our Fire Chief, Janine Nicholson, as well as our Deputy Chief of the Police Department, David Lazar. And we're here just mostly to tour and talk with a number of our dispatchers here at the 911 Center. And I just want to thank the dispatchers and the people who are part of this center, because I think what people don't realize is every single day, 24 hours a day, the people who work in this building, they are fielding calls on a regular basis of people that sometimes, sadly, are experiencing one of the worst times in their lives, and they're looking for help. And these folks in this building who show up time and time again for us, despite a pandemic, despite everything that's been going on in this city for the past year and a half, they've been here. They are wearing their mask and doing their jobs, and they're showing up for San Francisco. So I want to thank our 911 dispatchers for their hard work and their commitment to San Francisco. We just heard back from them about a number of things that they, of course, want to see change, and they want the public to be aware that when they call and you call 911, they hear a lot of calls and they know what is available. And what's important for everyone to know is, I know folks are asking, well, I want a paramedic, or I want a police officer, or I want the street crisis response team. Well, ultimately, they need to understand what is going on in the scene to the best of their ability, and they are able to make decisions based on what they hear from you. Ultimately, it's about public safety, and they can't just send anyone into any situation without making sure that they understand what's going on. And oftentimes, our police department are the first line of defense around issues that involve public safety. And when you are able to dig a little bit deeper, sometimes they recommend the street crisis response team or a paramedic. But ultimately, the men and women who work here every single day, they've heard a huge range of things. And they, as far as I'm concerned, are the experts and the best judge of what is most appropriate to send when you call 911. So trust them. Many of them have been working here for 10, over 20 years and have heard a number of calls from a number of people. And so we are here to express our appreciation for their hard work and ask the people of San Francisco, when you call 911, please respect and trust our dispatchers. Today, we're also celebrating 1 year of our street crisis response team. And so I know Simon Pang and others are here with us, and the behavioral health teams from the Department of Public Health. I mean, this was what some considered a crazy idea, bringing all these city agencies together to respond to the crisis that sometimes people are having on our streets. And the fact is, there's not a one-size-fits-all. You know, there are people suffering from schizophrenia. There are people who suffer from behavioral health issues and substance use disorder. And it's complicated. And sometimes people are violent, sometimes they're not. I went on a ride with the Street Crisis Response Team, and you know, it took about an hour to even get to a point where we could actually get that person over to General Hospital. We had to, unfortunately, do a 72-hour hold, 5150 that individual because of their behavior. But ultimately, they were in crisis. And even if they didn't have a weapon and weren't going to harm themselves, going in and out of traffic, you know, where a car could potentially hit them, or that person in the car who hits them could be harmed themselves, was a real problem. And so they have to use their own expertise, their own judgment to decide what is best for the individual that they are trying to serve. And this program came about in trying to find a non-police response to things that don't require a police response. We have a lot of challenges in San Francisco, and we truly appreciate and value our police department and the work that they do to serve and protect the people of this city. But we also understand that there are some calls that they are not necessarily needed. And so my preference is that when the dispatchers get the call, they make the decision sometimes for there to be the street crisis response team or a police officer or a paramedic, depending on the situation. And so this program has been in existence for years. They've answered thousands of calls. They help divert people to some of our many behavioral health beds, which you all know we have expanded significantly. And there's a commitment from me in this past year's budget to increase the number of beds by an additional 400. We're already over 200 additional behavioral health beds, and we plan to do more. The goal is to make sure that when we engage with members of the public who are struggling and having challenges, behavioral health related issues, that we are able to have a place for them to go. And sometimes that is not always the emergency room. So we know there are complex problems and complex solutions and other challenges that our city as a major city that's a very dense city, we know that there are problems and challenges we have to face. But I gotta say, I'm so very proud and grateful to all of our public safety officials who are doing the work on the ground to try and keep people safe. I'm grateful to them for showing up, and despite dealing with some of the most challenging of circumstances every single day, they still show up. So when you see our firefighters, our police officers, our paramedic, or anyone wearing a city uniform in any way, just give them a smile and thank them for their service, because they are doing the hard work day in and day out to deal with the challenges that exist in this city. So thank you again, everyone, for being here. We celebrate and we're grateful to our street crisis response team. We're grateful to our police officers and our firefighters and our Department of Public Health officials, our doctors, our nurses, our clinicians, all of the great people who were extraordinary and helped us through this pandemic. Our 911 dispatchers. We are so fortunate to have so many extraordinary public servants in this city. We're grateful for them working through this pandemic and continuing to show up every single day to serve the people of the city and county of San Francisco. And now with that, I'd like to introduce the Director of the Department of Emergency Management, Mary Ellen Carroll.
Thank you, Mayor Breed. I really appreciate the fact that you came in today. She spent time individually with our dispatchers to hear about their experience, got some feedback on the implementation of the SCRT teams and some of the other teams, and we're super grateful for that. I just want to thank also my colleagues, Dr. Colfax, Chief Nicholson, of course, Deputy Chief Lazar, for your support and partnership and commitment to developing alternatives for people in crisis. The role of emergency management is really to provide coordination during times of crisis. And there is no more significant crisis right now than the tragedy of what we see happening on our streets. At the mayor's direction, we, the Department of Emergency Management, are going to continue to work to identify and coordinate the vast array of these new resources that we have to do street response. This includes overseeing multi-department operations. We need to unify all of these different groups to figure out, are we doing this the most efficiently? Are we getting the results that we need? And ultimately, our goal is to improve conditions on the streets and sidewalks in our neighborhoods. Our dispatchers, just to reiterate, have increasingly more resources at their disposal to aid people working on the streets. But again, to echo the mayor, we need to trust their expertise. Please do not hesitate to call 911 or non-emergency if there's an emergency, and provide the information that these trained professionals are asking for. They care deeply about this city, and they want to get the information out and the help out to the people that need it. Some of their frustrations that they indicated is that, they have to sort of get into these arguments with people that are calling in to get the information. We just want to get we want to get the help to the person that needs it as quickly as possible. And so so that starts with calling 911 and then, responding to the prompts so that we can get that help out quickly. The emergency management side of DEM, we are drawing on our experiences learned during COVID, the development of all the relationships that we've had and the expertise that we developed to help our department partners here really effectively utilize the resources and work toward those common goals and outcomes. San Francisco is a leader in developing and implementing alternate response teams for people in crisis. And we at the Department of Emergency Management are so proud and honored to be able to help coordinate these efforts and bring us to our best outcomes for the people of San Francisco. Right now, I'd like to introduce my colleague, Dr. Colfax, the Director of the Department of Public Health.
Good morning, everybody. Thank you, Director O'Carroll. Hi, everyone. It's great to be with you here today. And I want to, of course, thank Mayor Breed for her tremendous leadership. San Francisco is fundamentally changing how we respond to people in crisis and leading a nationwide movement to pair healthcare needs like mental health crisis with healthcare response. And thank you again, Mayor Breed and partners for helping us do this. I want to thank Director Carroll and the 911 dispatchers. As you heard, they expertly triage 911 calls to ensure the most appropriate, effective, and compassionate response is provided to people in need. And this includes people experiencing nonviolent mental health or substance use disorders, routing them to the best response, the Street Crisis Response Team. Our community paramedics, mental health counselors, and peer specialists with lived experience together have a range of a specialty of skills to engage with people in crisis, de-escalate the situation, and address a person's immediate needs for care, treatment, and shelter. SCRT is truly a collaboration. As you know, staffing comes from the SF Department of Public Health, and of course fire, as well as our wonderful community partners at Health Right 360 and RAMS. In the first year, SCRT responded to over 5,000 calls. Those 5,000 calls represent a decrease in emergency room visits, a decrease in ambulance rides, and a decrease in law enforcement responding to nonviolent calls. And most importantly, each call is an opportunity to connect San Franciscans with those most appropriate services. SCRT is supported by a dedicated follow-up team who provide coordinated care within 24 hours of the initial encounter. Nearly a third of all people who interact with SCRT are successfully re-engaged with follow-up care, such as being connected to a provider or treatment facility for longer care. This is really about meeting people where they are and tailoring our response. So if you have a person on the street who's in a crisis, even the SCRT team, having all the people come together to wrap around that person, that's an important step, but you don't necessarily want to crowd the person, right? So the peer counselors, for instance, will often go out and engage that person one-on-one, saying, I've been here before, I have that lived experience. How do I talk with you and share my experience and then engage the broader team? They can then transport that person to places like Hummingbird, our low barrier care for people with mental health disorders. That low barrier care, getting that person off the street, linking them to care. SCRT is part of our larger effort to bring our response to the community. Our community-based teams like SCRT or the Street Overdose Response Team are truly removing access to barriers to care, treatment, and services. And I want to make one more plug. If you see someone in crisis, please call 911 to describe what you are seeing, and somebody will be there. And now it's my pleasure to introduce a great leader, partner, and collaborator in this response, Chief Nicholson. Thank you.
Thanks, Dr. Colfax. And yes, I just want to say thank you, Mayor Breed, for trusting us in the fire department to take on this critical role with the Department of Public Health and others. As you may have heard, Street Crisis Response Team, we also call it SCRT. I just want to give a shout out to some of the people that are here that are on the Street Crisis Response Team. There is one of our mobile vehicles over here. We have a community paramedic that has more training than a regular paramedic. They're trained in de-escalation. They can redirect people to other services. and a mental health professional from public health, and as Dr. Colfax said, a peer support person. And this has proved extremely successful. In terms of the 5,000 calls that we have gone on, 80% of them we have been able to address right then and there. And of the folks that we have gone out to help, 40% of them have accepted help and to transport to a psychiatric facility. That does not include people that we have had to 5150, but this is an extremely successful program. And of course, we're working out all the tweaks, but we look forward to more success. I also want to acknowledge Chief Simon Pang, who is the chief in the fire department who heads up community paramedicine. So if you have any specific questions, he is here as well. Thank you all for being here today. And again, a big shout out to our street crisis response team and to our 911 dispatchers. And I would now like to introduce our partner in public safety, Deputy Chief David Lazar.
Okay, thank you, Chief Nicholson. Well, what else could be said? Well, there's a few things that could be said. First, on behalf of Chief Scott and the entire San Francisco Police Department, I first want to thank our Mayor, London Breed, who back in 2020 was looking at policing and looking at the role of police. And we become the first line of city government in a lot of circumstances. And really, it was her vision that said, you know, we need to take this important issue of helping and assisting the mentally ill more away from the police and more towards professionals who are trained and go to school and are prepared to deal with the challenges on our streets. And that has evolved to what we see today. We have a lot to celebrate in 1 year. And as you can hear, that's 5,300 calls for service where the police are sometimes there, and we're there for public safety purposes, but we're not there to actually do the intervention and to help people. And so that is a lot to be applauded, and again, successful. We have a lot of success to celebrate. I want to thank Chief Nicholson and her leadership and her team. You know, unlike other cities in America, the police and fire like each other, and we're friends with each other, and we work with each other, and we're all promote public safety. I want to thank Dr. Colfax for all the tremendous work in public health, and last, I'd like to thank Director Mary Ellen Carroll that keeps it all together and maintains this building, and all her 911 dispatchers that do a tremendous job. And the last thing I want to say is, you know, I want to thank our San Francisco police officers. Just like Mayor Breed has shown such tremendous support for our officers working all throughout the city and during the holidays, I want to thank them as well on behalf of the chief and the department for what they do every day, working to help and serve the public and provide public safety in the city. So thank you very much.
I know our Sheriff Paul Miyamoto's not here today, but the people who actually help with securing this space are men and women from the San Francisco Sheriff's Department, and I want to thank them for their service as well. So with that, I want to open it up to any questions. Yes.
So I believe it was the week before Thanksgiving. There was a man who was shot at the CW Hotel. I'm curious if there are any plans, if you have any ideas to expand de-escalation services into SFPD and how they operate and interact with people with mental health problems.
Well, I think that what we have been doing around de-escalation has, for the most part, been working, and our police officers, of course, have a job to do when they're called to protect public safety. The chief last week showed the video and provided input. It's an ongoing investigation. There will be an independent investigation, but it appears that, you know, the training and what the officers learned to do around de-escalation were implemented in this particular case. And so there's an ongoing investigation about this case, and so I'm going to leave it at that. But at the end of the day, I'm really very grateful for the work that we have done in San Francisco around de-escalation and around the ability to identify and work towards a solution in most of these situations. And this was an unfortunate situation that occurred, but I think that our officers handled themselves appropriately.
Could I ask you, in terms of people noticing, because sometimes it takes people a long time in the city to notice, wow, the situation is getting better. How long do you think people, residents of San Francisco, will take notice of the fact that that people with mental health issues are getting the help that they need?
Well, I think it's hard to say. And the reason why I say it's hard to say is because people have struggled with mental illness since the beginning of time. And the fact is, we as a society, as a city, as a state, as a country, we have not handled it very well. We are doing the best that we can within the laws that we have. But one very important law that is missing in order to really see and feel a difference has everything to do with force. And that means forcing someone into treatment, forcing someone into, some cases, a locked or unlocked facility based on what their issues are. And so there's a huge push around, we don't want to take away someone's rights, and I totally understand it. But I'm going to tell you right now, I see elderly people out on the streets who have dementia, who have no family members, who have no one making decisions for them. And then when we take them into our care and we try to get them help and support and make sure that they're not outside doing things that they would not normally do if they didn't have dementia, as soon as they say, well, I want to go, I don't want to be here, we have to honor that. And so the system is broken as a whole and needs to be changed. And so we don't necessarily, unfortunately, have the local jurisdiction to make those changes. We need a change in state law, and we need a change in this country about how we address mental illness, whether it's those suffering from substance use disorder or those suffering from dementia, schizophrenia, and all of these other ailments that may impact the mind in a way that makes it so that people are out here on our streets. So my hope is that what we are trying to do is we're trying to manage the situation as best as we can within the laws that we have. We're trying to provide the resources. But the last piece of that is we can't force someone to stay in our care. We can't force someone to stay in a treatment bed. We can't force someone to not behave a certain way. We can't force someone to take their medication. There's a number of layers that go into that. And so we are still missing the most important layer to seeing a real difference a lot faster in our city.
Reed, this question kind of revolves around public safety, and it's directed for you, Dr. Colfax and Deputy Chief Lazar. First is having deputies serve as guards. I know that's up for a vote later on today. Deputies will be off duty and also be used by private business.
You mean sheriff's step? Yes, thank you. Okay.
To be also used as
Work off duty in the private sector, yes.
just a reaction as well as maybe an update as to further steps in securing or having security measures stepped up after the April robbery.
Yeah.
And continuing further.
Well, I think at the end of the day, it's a sad state of what we're living in terms of what we unfortunately are seeing with these mob-style robberies and a number of other, the burglaries, the car break-ins, all of the things that impact the quality of life of people who not just visit San Francisco, but people who live here. And the people in this city want to see change. And at the end of the day, if those people who visit have a terrible experience, they're not coming back. So it's going to, of course, impact our bottom line and the ability to pay for all of these programs to help homeless and mentally ill and people struggling with addiction. It's going to impact our city as a whole. So that line of defense with our police department, our sheriff's deputies, is going to be critical, a critical piece to helping to maintain safety. That's just what it is. Yes, we have our ambassadors. Yes, we have different responses to calls that people make to 911. Yes, we are trying to make the reforms and to ensure that the appropriate interactions take place with law enforcement in San Francisco. But at the end of the day, people want police officers. They want to make sure that our streets are safe. And we're going to do everything we can to make sure that they are. And that's part of it. And by expanding, the ability for sheriff's deputies to work off duty at these various locations, that's only going to enhance public safety. And I am fully in support of that.
Also on the public safety front, of course, a new variant. What steps are the city taking to limit or to prepare for the possible impact of the new variant?
Well, I'll let Dr. Colfax talk specifically about that, but sadly what it means is some of the requirements that we have in place that we were planning to relax, we probably won't be able to relax right away. It means that we don't know, just like with COVID, when it first happened, we didn't know specifically the impacts. We don't know yet. We don't know when it will be in San Francisco, but the likelihood that it will be here is likely. We don't know if it's going to be worse or better than the Delta variant. So there's a lot of things we don't know, but we are paying very close attention to this. We are working with a number of health experts all over the country, and we are just preparing. And I think ultimately what has been said time and time again, get your vaccine, get your booster shot if you're eligible, and do everything you can to make sure that you are protected. So even if we see, that this is worse than the Delta variants, you do have a layer of protection with the existing vaccine, but there may be more needed as well. So we just don't know what we don't know, but as soon as we know, our plan is to make sure that the public knows everything that we know. Dr. Colfax, did you want to add to that? Okay. Yes. Okay, last question. Good? Yeah.
One more, if you can react, I know there's a video that was circulated, and I think the Chronicle just posted about it.
Yes. Well, first of all, let me just say that I am a big supporter of nightlife and going out in San Francisco. And in fact, there are rules and regulations put into place in a number of nightlife establishments. Number one, when you walk into those establishments, you have to have a mask. Number two, when you leave, you have to have a mask. Number three, when you go to the restroom, you have to have a mask. And I was in a private area with my drinks, with the people I was with, enjoying myself at a venue, and I had a great time, and I followed the appropriate protocols. And yes, I was dancing, and yes, I was drinking and having fun. And at the end of the day, I am doing everything I can to follow the existing protocols. And I think, sadly, sometimes these videos are taking out of perspective. I took pictures with people who wanted to take pictures with me. I am out there in the public, not just supporting nightlife, but out there at our restaurants, shopping at our various locations, doing what I feel as mayor I should be doing, but also as a human being who's been through a global pandemic, who did everything I could to make sure that the people of this city was safe, which is why it is no coincidence that we not only have one of the lowest death rates of any major city in the country, but we also have one of the highest vaccination rates. So I'm doing my job, and I am following these protocols. And what I said to people time and time again, that we need to do our very best. And I felt that I was doing my best in a room full of vaccinated people at a nightlife venue, which is a consistent thing that occurs. So that's what I have to say about it. I'm going to continue to support our nightlife and go out and enjoy myself as someone who is a single woman living in a major city who is having fun. But I want to be clear, I'm not out there making the rules and then not following them. So it is just not fair to try and take a snip of a video, which I knew was done by somebody who was at my table, and use that as a way to indicate it's something other than what it is. Doing exactly what I would expect anyone else to do when they're out at a nightlife venue, drinking and dancing and partying and having a good time. Thank you.